All right, guys. Well, while everyone starts to join us, I think we're gonna get things started and going. I just want to thank everyone for being here with us today, from Mala to the amazing panels that we have here. I'm really so excited to have this session with you guys and to have this event. For those of you who may or may not know me, my name is Lina Zahra, and I am a Syrian American social justice champion located in Chicago. I've spent over the past 6 years in the humanitarian nonprofit sector due to a very personal tie being Syrian American and seeing what has been going on in really the past decade in Syria, really wanting to specialize and work in international development and humanitarian emergency contexts, specifically also with refugees and other forcibly displaced persons. I've worked with small to large scale NGOs, from the wonderful Kerem Foundation to the International Rescue Committee to the World Food Program, to the United Nations, and even the United States Senate. Currently, I'm involved with Mala actually as a Young Leader Fellow. I'm also the advocacy lead for refugee and immigrant rights with the United Nations Association of Greater Chicago's volunteer network. I am also the advocacy specialist and board member for Insight Collaborative, and I also volunteer with the Syrian American Council. So again, thank you everyone for being here today. I'd love to introduce and bring forward Flex from the Mala Foundation. He's the Deputy Director and co-founder of Mala. So Flex, we'd love to hear from you and to know more about you.
Yeah, absolutely. Thank you so much, Lena, for putting together this incredible panel on building peace and breaking stigma. My name is Ahmed Flex Omar, and I'm the co-founder and deputy director for MALA, the Muslim American Leadership Organization, Muslim American Leadership Alliance organization. We are a 501c3 that was established in Chicago in 2015, and we focus on arts and culture and storytelling. We've built the first ever Muslim American heritage database at the Library of Congress, and we use storytelling, to empower our community, but also connect with folks that have a shared heritage with the Muslim community. Right now, we're in Ramadan. I believe we're getting, towards the end. Next week is Eid, and the last 10 days of Ramadan are really important, for Muslims, because the last 10 days are the holiest, days of the month. And these are the days where we really focus on, our, Islamic, rituals, but also focusing on giving back and to the community. The issue of refugees is near and dear to my heart. I'm a genocide survivor and a refugee from Somaliland, and I've been living in the Chicago area for the past 20 years or so. So Chicago has been a great city and very welcoming to me and also to other refugees. And Mala being established, here we've done a lot of work with refugee communities, and focusing a lot on entrepreneurship projects and giving them access to folks that normally they wouldn't have access to. And I know I have a presentation later on, Lena, so I don't want to take too much time, in the introduction, but I just want to, thank, the panelists and thank you and our audience. I know it's a work day, and, thank you for joining us today.
Yeah, definitely. Thank you, Flex. Yeah, again, thank you for taking, whether it's your lunchtime or for one of our panelists, Maddie, she's in Washington, so it's morning for her. You know, we're kind of wherever you are. We just really want to thank you for being here with us, and thank you, Flex, for sharing obviously your incredible story and all the wonderful things that Mala is doing, and we're so lucky to be a part of. So I'll do a little housekeeping just so everyone on the call kind of knows the structure, what to expect. So kind of, you know, from here on out, I will be giving a brief introduction to the topic, you know, why we're all here today. I will introduce our other panelists, and then they will share a brief background to the topic, to the important work that they're doing in the community. I will have a series of questions for the panelists as well. And then we'll end with the Q&A from you all, from the participants. I will ask if you leave the questions, you know, try and do it toward the end, but I understand they come up. Just use the Q&A function on the Zoom call. And of course, though, if you're having or seeing kind of any issues, concerns, especially you know, audio, things like that, just feel free to also drop that in the chat box, and we'll be keeping an eye out as well. We're just really excited to be here with you all, and you know, and share these stories. So without further ado, you know, let's get started. So the call and why we're here today, you know, building peace and breaking stigma. You know, I can personally say that through the times that we're in right now, through COVID-19 and the current pandemic, it's never been a better time to check in on each other, but also really kind of come together in a sense of connection and shared humanity, and really understanding for communities near and far what that support looks like, and especially opening our hearts and concerns to the most vulnerable or at-risk communities, and making sure that we highlight that in the response. And so I hope that you get a sense of that through Mala and through our other amazing panelists. Really, the importance through connection is storytelling and peace building. So for the work that we are all involved in, more or less, refugees or other forcibly displaced persons, you know, I would say arguably are one of the most affected, not just by in terms of the level of support that's needed, but really the rhetoric, the narrative that's being shared. Oftentimes the refugee label is not properly identified, maybe inaccurately portrayed, and unfortunately, which can be applicable for other communities, often the first to be blamed, used as a scapegoat, or stigmatized. So what we're here is to really shift that narrative, to understand beyond the statistics, you know, what is the individuality behind our communities, that often goes unrecognized or kind of pushed to the sidelines even further. And knowing that you are not your circumstances, which I think is transferable to a lot of you know, vulnerable communities. You know, we're here to say that we can no longer afford to, you know, exclude this from the narrative, and we really need to scale up our advocacy efforts truly for an inclusive global health solution. That being said, we really honor and recognize that for the 70.8 million forcibly displaced around the world, which today is about 44,000 individuals every day being forced to flee, that there are many that are also obviously, you know, addressing or, you know, affected by the pandemic, but also participating in Ramadan, which Flex greatly kind of shared in terms of being a crucial month of fasting and spiritual awakening and connection, especially these last 10 days. So I'm just, again, so grateful that we have you all and our speakers that are coming from global and local front lines to really understand the nuance of the refugee crisis. It's not one, you know, it's not one in the same. It can't be generalized. And we really need to understand the current needs and how we can really all do our part even in the smallest ways in offering our support, but also recognition and highlighting the dignity and the autonomy of our communities, and kind of a scope of shared humanity. So I'm excited to introduce the other panelists. So the first person I will introduce is Maddie Williamson, who is a dear friend of mine from, 2016, I think, Maddie. We both were volunteering in northern Greece, in Edamini, where there are different groups of refugees, asylees, that were fleeing and trying to seek asylum, safe asylum and refuge in the EU. And since then, Maddie has become a registered nurse and established a nonprofit called, Insight Collaborative. And Insight really is an exceptional initiative to improve the way we deliver, international humanitarian aid by honoring and promoting the autonomy and dignity among displaced populations. Insight does this through partnerships, advocacy, and education. Insight continuously partners with displaced communities as they determine their needs, and local NGOs, international operators, to really connect resources and solutions in the areas of most need. So we're really excited to be having Maddie. Second, but not least, we have Jims. Jims Porter is the manager of communications and advocacy at Refugee One, which is actually Chicago's largest resettlement agency. In this role, Jims works to raise awareness about refugees through community education, media engagement, and advocacy, actually at the local, state, and federal levels. He works closely with local and national partners to mobilize communities and building coalitions. One in particular that I have the honor of knowing, which is the Golden Door Coalition. So that is Chicago's refugee advocacy organization. If that isn't enough, Jims, the incredible Jims, is also the board chair of the Queer Asylum Network, which is a new Chicago nonprofit working to support LGBTQ asylum seekers. And prior to moving to Chicago in 2016, Jims was really focused on strategic philanthropy and nonprofit development in Louisville, Kentucky. And he comes from a background of journalism and political science from Indiana. So without further ado, now that you know our wonderful panelists and what they're doing, we'll get started. And Maddie, if you want to take it from here and share what Insight is doing.
Yeah, of course. Hi, everyone. Thank you so much for having me on. Good afternoon to all of you, and good morning to anyone in my time zone, Pacific Standard Time. I'll try to keep this brief because really we could talk about Insight has so many facets, mostly because we have such amazing involvement from a very diverse group of people with interesting backgrounds, different focus areas, but what we really come together and unite over is this common concept that we can be doing better. And the way that we want to do better is through the power of advocacy and story sharing. When we started in 2016, before we were a nonprofit organization, our main focus was on sharing as accurate, and I'll say refugee or forcibly displaced person-led narratives from the front lines, as well as sharing narratives from grassroots organizations, independent volunteers, people who are on the ground having these really powerful and authentic experiences, and who had, I don't want to necessarily call it criticism, but just general commentary on how we were intervening in these humanitarian crises and how we could be doing better, because there's always room for improvement so long as we take a second to kind of step back and analyze. So our organization was sort of built on more of a question of like, how can we be doing this better? We fully understand that we don't have hard solutions, and that oftentimes kind of diving in and just connecting with people, building really trusting relationships, asking people what their reality is like and their experiences, and sharing all across the board, that can cause these shifts that we really need to not only understand these situations better, but also to design better interventions And so that's kind of what we're all about. We're always open to anyone who's wanting to network with us. We're huge on building a community, building a platform of people who are active and involved in lots of different facets, and seeing how we can support and encourage each other going forward.
All right, thank you so much, Maddie. James, if you'd like to go next, we'd love to hear more about you and Refugee One.
Sure. Thanks, Lena, and thanks, Maddie and Flex and everybody who's helped set this up. It's really an honor and a privilege to be here today to talk about these issues. Thanks, Lena, for the generous introduction. As she said, my name is Jims, and I work at Refugee One, Chicago's largest refugee resettlement agency. Our mission at Refugee One is to help refugees who have fled persecution and ultimately to help them build new lives of safety, dignity, and self-reliance. And the word self-reliance is really key to all of our programs and our services. We walk alongside refugees, helping them initially by finding and furnishing their first apartment when they arrive here in Chicago. And then we also provide English language training and workforce development services and immigration services to help them reunite with their family members who might still be overseas. We also have a robust youth program that serves more than 500 kids each year. And we have a culturally sensitive mental health program to help refugees overcome trauma. Our staff at Refugee One is more than half refugees and immigrants. And so many of our staff have the perspective that they've lived through these things themselves, and they're able to bring those experiences into the work, and because of that, provide better service delivery. We speak 35 different languages amongst our staff, so we have really the cultural and linguistic expertise that's needed to help refugees from all over the world who are seeking to build a new life here in Chicago. We partner with over 1,000 volunteers throughout the Chicagoland area, so we're incredibly fortunate for all of our community partners, from employer partners, communities of faith, and individuals who also reach out as volunteers, helping tutor refugee adults in English or help refugee children catch up with their peers in terms of academics and socially and emotionally as well. And my job, like Lena said, at Refugee One is overseeing our communications and our advocacy efforts. And so I really see my role as essentially trying to figure out how to make people care about these issues. And sometimes that can be challenging because, especially right now, there's so much noise, there's so much going on in terms of the media and so many important things to pay attention to, that it's often difficult to capture people's attention and help them focus on this issue in particular. So I really focus on how to tell stories, both in communications and in our advocacy efforts, that are compelling, that they compel people to take action, but while also presenting an accurate portrayal of refugees and their stories and their own autonomy. So it's really a privilege to be here, and I'm excited to dig into some of the content that we're going to discuss today, but I'll wrap up with that.
Yeah, I love that, Jims. Yeah, thank you. Thank you so much for sharing that. Flex, do you want to talk a little bit on your end with Mala?
Yeah, absolutely. Since we're on the subject of storytelling, and Mala's a storytelling platform, I can share a little bit about the story of how Mala started. Mala, the reason why we created Mala, my co-founders and I, were because we saw in around the years leading up to 2015, when we actually got our 501c3, that Muslims in America were not represented, the right way in the media. And we also noticed that a lot of our refugee communities were struggling. A lot of our youth were struggling, with having an identity crisis. What does it mean to be Muslim, and American? And what really was tough for me is in Minneapolis, in a Somali community, when young kids were radicalized and recruited to go fight, with Al Qaeda, And we knew then that we had to, educate, our communities on our heritage, but also, find ways to work with refugee, families when we were creating Mala. We knew that there was a lot of issues that we wanted to tackle, but we couldn't do all of it without building, a coalition of partners in a community. So we started with storytelling. And one of our first, partnerships was with Malala Fund, young lady that was shot by the Taliban who won the Nobel Peace Prize. And we did her film premiere here in Chicago. And we also did 19 screenings, nationwide. But during these film screenings, we would meet with different refugee communities, whether it be in Dearborn, Michigan, or Minneapolis, Minnesota, and we can see the impact that the film will have on, on people, and especially the youth in the community. And we would take that opportunity to ask them to share their own, story and empower them in that way. But then through the years and, collecting all these narratives and all these, stories, we've started to see, a theme, right? So a lot of these folks, before they became refugees, had identities, back home, had jobs. These people are skilled. They have, passions. So through the storytelling, we're able to identify how we can better, serve, the community. And then we would reach out to folks and say, hey, would you like to be a speaker on a UN panel? And I would say, I don't know how to do public speaking. We're like, well, we'll coach you, because if the UN is talking about, a particular topic on, violence against women and so on, I would rather have someone who's lived that experience have the opportunity to share their story and empower them. So with Mala, storytelling has just been a powerful tool, for us to grow our community, but also speaking to people that are therapists. We were told that storytelling is a form of therapy, and it's called testimonial therapy. And that's what we've seen when we're recording our stories, and we bring people to our story booth in partnership with StoryCorp here in Chicago and other cities, that for the majority of folks, this is the first time that they're sharing their personal, narrative, and it's really incredible, and it's really emotional, yet powerful. And that way, and that's a way we've been able to sort of like remove the stigma that surrounds refugees and immigrants and people in the Muslim community. So a lot of our work focuses on arts and culture, and again, I can go on and on and on. We do a lot of work, but I don't want to take too much time, because I definitely want to give you an opportunity to get into the questions part.
Well, thanks, Lex. And I just want to say that, and I'm sure everyone that's on the call can agree that throughout all of your work, I mean, just the importance of, knowing that there is a lot of noise out there, like Jim said, but, how do we show up, I think is so important. And, all of you are doing amazing things in the concepts of sharing stories, and really knowing that there's just so much power in recognizing stories, giving that individuality, the person, the people behind kind of what we're hoping to advocate for, whether it's understanding the nature of humanitarian aid or the communities that we're working with. I think we can all agree just having that accurate representation, and hopefully sharing how compelling and how important it is for people to get involved, and how people would be surprised that they can and they should get involved, in even just the simplest ways, and even in a virtual world that we're still kind of living in, how they can do it. So really excited to get into the questions. So I'll get started. So the first question that for the panelists that I love for the participants to get a sense of is understanding really the generalized vulnerability. Let's say, you know, whether or not people are familiar with the refugee or asylee community, what would you say are kind of the biggest needs right now, especially I would say during COVID-19? I'd love to hear, you know, first from Jim's and then Maddie, if you could kind of follow up on that, that would be great.
Yeah, sure. Happy to talk about some of the needs that we're seeing amongst refugee communities here locally in Chicago. I guess I'd start just by sharing that many of you might know, if you're from the Chicagoland area, that most refugees make their homes on the north side of Chicago in the West Ridge neighborhood. And actually, there was a recent article published by Block Club Chicago that looked at the hardest hit neighborhoods in terms of COVID-19 throughout the city. And West Ridge was one of the hardest hit neighborhoods, if not the most hardly hit. And we see that that the refugees who live there are experiencing many of the direct and indirect consequences that come from COVID-19. So some of the vulnerabilities that we're seeing and some of the needs that we're seeing are first language barriers. You know, refugees and asylees, many of them are recently arrived and are still learning English and working on their language development skills. And so there's a real need to provide accurate information in refugees' own language. That's something that resettlement agencies and aid organizations are able to do. Like I mentioned earlier, we really have the linguistic capacity to help refugees, you know, in their own language and make sure that they're receiving that important health information that it would otherwise be delayed, you know, coming through other channels. We also see that refugees are continuing to work on the front lines of some of the most essential industries. So they continue to put themselves at risk by going to work, and that obviously heightens their anxieties and uneasiness about the situation as they're taking public transportation to get to work and exposing themselves in the workplace. Many refugees who don't continue to work on the front lines are experiencing unprecedented layoffs and unemployment and a lack of income that's obviously creating a lot of new concerns and anxieties for their families. They're concerned about making ends meet. You know, they're concerned about making rent payments. On average, refugees that we work with pay about $1,200 a month for a 2-bedroom apartment in Chicago. So that adds up really quickly the longer the pandemic goes on. So we're looking for ways to support them in those needs. We're also looking for ways to support families holistically. You know, many parents, like I said, are still learning English, and at the same time, they're expected to help their kids with e-learning. So we're looking for ways to provide those services and that support virtually for now while we're not able to meet in person.
Yeah, I think that in Insight's work, we are a little more globally focused, but I like a word that Jim's used, which is holistic. We have to be really holistic in not just analyzing the impacts that this pandemic is having on these communities, but also in how we're intervening and how we're helping kind of bolster their resilience to something like a global pandemic that no one alive today really has a point of reference for. So the challenges that we see in international humanitarian aid interventions and delivery, pathway interruptions are a very big deal for us. We work with populations of refugees in somewhat in Lebanon, but mostly in Greece, that are still very much on their journey of displacement. And so this pandemic has caused shutdowns that are really disruptive to asylum processes. That's very distressing for people to have that huge unknown or even just a known delay in their asylum or reunification. That's a very big deal. And then from a logistical end, which is a little bit more of what I do as the director of the organization, supply chain interruptions for services like food, medical supplies, shelter, that has been a huge challenge for us, not just meeting people's needs in the midst of a shutdown, but also how are we anticipating the downstream consequences of the entire global economy as we know it facing this huge shift. We also have just generalized anxiety from the refugee populations. My organization, even though we work on more humanitarian aid delivery at the moment, our main priority is building a trusting relationship and a close relationship with the populations that we are in working with. And there is certainly a lot of anxiety from people, even if they're living in a structure or a system where they theoretically get medical support. They know that even if these large hospitals, larger, more effective medical systems are not able to provide life-saving care to their general population, refugees and displaced people in the context that we work in the North Aegean Islands and in Lebanon know that unfortunately they're kind of at the bottom of the food chain. They're in healthcare infrastructures that can't support the best of times, that can't even support their own citizens in the best of times. And now we're facing this huge pandemic that no health system has any point of reference for. So those are kind of our big challenges that we're looking at, right? How are we going to continue to supply life-saving services, food, medicine, shelter to people, but how are we also going to support them psychologically and logistically through those major interruptions?
Yeah, wow. Yeah, thank you both for sharing that. I think it goes without saying that there are certain, unfortunately, inequalities and injustices that were present before the pandemic, but now, of course, are being heightened and really, really deserving and of seeking kind of whether it's local, regional, or international attention. So, thank you both, obviously, for the wonderful work you're doing. I'd love to shift to the concept of course, in light of the pandemic, but in terms of Ramadan. And for those, again, not to generalize that, you know, many or all refugee communities participate, but a good majority too. So I'd love to ask you, Flex, you know, what would you say are kind of the additional or maybe current restraints that the pandemic has placed on, you know, either refugee or just generally for Muslim communities currently practicing or participating in Ramadan?
Yeah, absolutely. So for folks that are not familiar with Ramadan, Ramadan is the 9th month on the Islamic, you know, calendar, and it's our holy month, and that's the month that the Quran, our holy book, was delivered to Prophet Muhammad. We fast from sunrise to sunset. And when it's a little bit warmer, it's tougher because you break your fast at, you know, 8 p.m. You know, so if you're someone, you know, that's working, you know, it's not easy, but it's incredible, you know, how, you know, as human beings we quickly, you know, adapt. In regards to you know, the refugee, you know, community, I lived on, you know, the north side, the ridge area where Jim's, you know, mentioned, and we've been, Mala set up a COVID-19 response, you know, platform for, you know, people to reach out and, you know, share some of their stories or what they're going through, and just through our community to see how we can help out. And some of the stories that are coming out of the community, refugee community, is truly, you know, heartbreaking, especially with, you know, elderly people getting sick, and now these folks need help with, you know, paying for, you know, funerals, you know. So we've been helping with that. You know, obviously the kids are not going to school right now, so they're at home, you know, so e-learning is, you know, important, you know. So we've been you know, working with, you know, different, you know, groups to see how we can help out in that area. So there's a huge, you know, need, but also, you know, Ramadan is a month where we celebrate, you know, community, and iftar is you know, really important for people to come together, you know. So all those mosque activities are now, you know, no longer, you know, happening, and I think that also sort of dampens the mood. But at the same time, you know, we're seeing, you know, people are still staying, you know, positive, and, you know, keeping faith, you know, during these times. So we're looking, for ways to, inspire people, but also encourage them to, reach out if there are, emergencies, if there are certain, needs, because if we don't help each other, during a pandemic, when are we going to help, each other as a community? But the need is, definitely very high right now in the refugee community on so many different, fronts. So luckily for us, we have a long list of, partners, and we're able to connect, folks to, different organizations that specialize in, different areas.
Yeah, thank you so much for sharing that, Flex. I know for myself, I'm Muslim and come from a family that participates in Ramadan, and showing what that could mean and impact for other communities participating. I'm so glad you mentioned the aspects of, like just even going to the mosque, like that's such a big part. And I'm sure for a lot of our, refugee families, that would be a time to kind of come together. And now, of course, we're shifting to everything being virtual. So breaking iftar, usually we're getting together as friends and as family. So that's also, of course, have had to shift in terms of making sure that no one feels isolated in this month of connection and community, and that we're there for one another, and we can still, whether Muslim or not, kind of be a part of that symbolism and that capacity to be together. So thank you for sharing, Flex. So something I want to address, and I'm going to use the buzzword pivot. So we've been hearing a lot of pivoting. How are we pivoting? But I'd love for everyone who may or may not know this to know, how has, in the sense of international humanitarian aid, and also resettlement work in the U.S., really how has that had to change, and because of the pandemic? And then, of course, if you know of any of your communities participating in Ramadan, how has that maybe shifted for them as well? The support that, you might usually provide during the pandemic. I'm sure our participants would love to hear that. So if we can start with, let's start with Jim's, and then we'll go to Maddie.
Sure. So like, all service delivery organizations, we've really had to reevaluate the way we do things because of COVID-19. We've really started to pivot from our regular services, which we continue to provide, but virtually for now, to meeting the immediate needs of refugees living here in Chicago. And so our regular services have all gone remote, like I said, including our therapeutic services and our home visitation services. So we're able to continue offering those programs. But we're now focused also on new needs that have arisen because of COVID-19. Like Flex said with Mala, Refugee One has also launched a special COVID-19 fundraising campaign to help those that have been affected both directly and indirectly by the pandemic. And so some of the things that we're doing differently now, or that we're doing more now than we were in the past, we see a really big need to help individuals navigate complex systems in the United States that might be new and unfamiliar to them. So for example, helping individuals navigate the healthcare system and health insurance, and trying to figure out how to get the care they need and navigate that whole process is something that we're definitely spending a lot of time doing right now, and trying to help refugees in that sense. We also are spending a lot of time, our employment specialists or our workforce development specialists are helping individuals who have been laid off or are experiencing unemployment to apply for unemployment insurance and qualify for the benefits that they can receive to help them through this time. We also are helping individuals who are experiencing unemployment to look for jobs that are currently hiring, so delivery type jobs and other opportunities so that they can continue making an income during this time and supporting their families and ultimately working towards self-reliance. We are helping individuals, apply for other types of aid as well, whether it be at the state, local, or federal level. So we're trying to ensure that all refugees qualify for the direct tax rebates that come from the CARES Act. As many of you might know, the most recently arrived refugees don't meet the residency requirement that's in place to receive those payments. And so we find that the refugees who have arrived most recently are kind of slipping through the cracks. And of course, it's my belief that the United States has made a commitment to these refugees, that by helping them resettle here, we'll help give them the tools and the resources they need to be effective in doing that. And so we're trying to also focus our efforts on advocacy for refugees to be fully included in all relief efforts. That's one place where the Golden Door Coalition, Chicago's refugee advocacy group, comes into play. The Golden Door Coalition has put together a platform for COVID-19 relief for refugees. And if anybody's interested in learning more about that, they'll be sharing our contact information after this. So I'd be happy to connect on that front and help you understand what we're doing to make sure that refugees and immigrants are receiving the support and the relief they need during this critical time.
Yeah, good, wonderful points, Jim. I'm like, my huge focus is international humanitarian intervention. So I love hearing what people are doing at home, because like I'm a nurse, and having worked in an emergency room, the insurance stuff is like a huge nightmare to navigate. I can't imagine how terrifying that would be for someone that's like their lifeline. So for those of you who haven't had like firsthand experience in an international humanitarian setting, something that I feel like isn't communicated enough to the general population who doesn't quite recognize or isn't familiar with that reality is that these camps have a lot of stagnation, especially camps where people are waiting for asylum decisions to enter the European Union. So the North Aegean camps in Greece, camps in mainland Greece, camps in Italy, there's a lot of just sitting around and waiting. And so part of what makes this disruption to the asylum process so distressing is that it means there's even more idle time. And that's very, very damaging to people's mental health. And so with Ramadan, there's always been a huge emphasis from all of us in the humanitarian sector to preserve these traditions, because that is really the best mental health intervention that we can stage. So at the moment, as Flex mentioned, these traditions and these patterns of habit that people had, even going to the mosque daily and getting to go and pray and interact with your community, that is a lifeline for some people. And right now, a lot of those traditions and practices are having to be put on hold because it's just not safe for people to congregate. So, and a consequence for us as far as trying to deliver the resources to encourage those really healthy, those healthy traditions, we have less contact with the communities because we're not able to go into camp and distribute. And so what we've really had to do is make sure that when we stage any sort of intervention, it has to count. So in Greece, and in anticipation of Ramadan, we talked to the community and said, what is going to be the best thing that we can do for you guys? Of course, getting dates, that's a vital part of breaking fast. Every day during Ramadan, that was a huge priority for the community to have dates. And so my colleagues on the ground in Greece figured out a way to get dates in without violating any of the rules of the lockdown, which was amazing. We also bought Qurans and prayer mats for the mosque communities to distribute to the most vulnerable in the community, like people who maybe aren't able to go to the mosque areas to use the supplies that are there, or people who maybe can't read the Quran on their phones, like older members of the community. That was a specific request from them. So less contact time with the community means that we have to be a lot more precise in the interventions that we're designing and implementing. But yeah, and on that note, I mean, what that has kind of forced us to do is really reshuffle and reallocate our funds in ways that we haven't had to do before. So every organization is raising funds right now in response to COVID, but for us, it has been a significant financial interruption because the urgency at which we need to buy things has increased. And also the cost of delivering things, as I mentioned, supply chain interruptions, that we've managed to overcome almost all of them, but at a much higher cost to our organizations. So that's another reason why we've really tried to pinpoint our precision with what we're delivering to the communities and how we're doing it to make sure it's something that is going to help them as effectively as possible.
Thank you so much, Maddie and Jims. One last question before we open up to the participants. We're already getting some questions, which is great. I think it would be really great to hear from you all in terms of, we spoke a lot in the beginning about incorporating refugees and even like their background in the response or their narratives, making sure we're giving a very authentic representation. So I would just love for you to elaborate a little bit about how we can, highlight, of course, the autonomy of refugees during this time, and really how can we incorporate themselves or their work or their stories, in either the humanitarian or resettlement response. So we'll hear from all of you, but let's start again with Jim's, Maddie, Flex, if you have any quick points. I know the participants would love to hear that.
Sure. I'll try and keep it brief so we can get to some of the participant questions as well. But in terms of highlighting the autonomy and the resilience of refugee and asylee communities, I think it's really important to remember first that refugees have already survived before they get to the United States, because that's what my role is helping them once they get here. But by the time they've got here, they've already survived so much more than most people ever will in their life experience. So we know that when they arrive, they are determined and they're motivated to succeed, and above all, they're resilient, they're survivors. And so refugees are good for our communities, and they're good for our country as well. And I think it's important to highlight stories or tell stories that highlight that, as opposed to kind of the old narrative, that we often hear about refugees being vulnerable and helpless and relying on the support of others. I think it's important to remember that they are autonomous and that they have the ability to take action and support themselves. And that's something they've done for a long time before they ever even arrive in the United States. I also think in terms of how we can incorporate refugees and their background skills into resettlement efforts in our response. There's some really great efforts at the state level right now in states across the country to make sure that refugees and immigrants who have medical experience from prior to arriving in the United States are able to go to work in that field and work in the healthcare industry and have their credentials transition and be able to get the insurance and liability that they need to be able to practice here. So that's one effort that I know is being implemented at the state level to try and help refugees be a part of this solution to the pandemic that we're experiencing. And then I also think, I'd make another point with advocacy. I think it's really important that all of our advocacy efforts are driven by refugees and the needs that they're experiencing. It's easy for people like me. I'm not a refugee. I've never lived that experience to come in and try and find a solution. But I think the more effective way, and what we're trying to get at today, is how we can listen to refugees and see what their needs are and really follow their lead. Make sure that they're leading these efforts and that we're being responsive to the things that they're sharing with us.
Everything said. I echo those sentiments. Everything from even at the point that I usually meet refugees on their journeys, whether working in Turkey, Lebanon, Jordan, Greece, they've already survived the large-scale event that displaced them in the first place, and so their creativity, their resiliency is incredible. And when you go through one of those situations where you have to survive, you really have a super solid understanding of what your needs are and how to meet them if you've been able to survive an event like that. And so, yeah, what we emphasize at Insight Collaborative is absolutely in that vein, that if we want to be intervening in a way that's effective, in a way that's self-sustaining, in a way that's appropriate and respectful, we have to be listening directly to the needs of the community. And something that I have to be very aware of, being a passively white, cisgendered, American, educated female coming into these situations, is I'm sort of bred to believe savior complex. It's like something that's fed to me in the media. It's fed to me through the culture that I've grown up in. It's important from where I stand as well, and this is something that refugees don't necessarily have this privilege, is that I can speak to an entirely different population of people from a different perspective and try to encourage them to listen. So everything that Jim's is saying, that we absolutely have to listen to the refugees very carefully and hear what their personal experiences and how they perceive their needs being met, what the best ways to do that are, but also for me to recognize I have a special responsibility of being able to communicate and act as sort of a bridge. I can listen and then I can go speak to people who may not be willing to listen to that refugee voice or may not know how to.
Yeah, thank you, Maddie and James. I'm gonna also echo everything that both of you have said, so far. One thing I would like to add, just from a refugee perspective, just personally, recently did an event with the Karam Foundation, and one of the doctors on the panel, Dr. Hadia, mentioned the term post-traumatic, growth. And I didn't really, I never really thought about that. I always, would hear PTSD and, stress and disorder and so on. So how we, frame certain things, around, refugees and is really important, because Jim, like you mentioned that, a lot of these, some of these folks are, were doctors in their countries. And I would always, tell friends of mine that, for example, Syria, their largest export to the world are doctors, or Syrian, doctors. So giving, looking at this, from a different lens, and, and empowering, refugees is the way to go. And for example, one of our community builder members, he's a refugee from South Sudan, and he is a game developer, and a couple of years ago he was in a refugee camp, but now he's going to be debuting a game on Facebook that focuses on a kid that's in a refugee camp, but there's going to be in-app purchases that are going to be enabled through the game, and those that money that's raised through the in-app purchases are going to go to, benefit refugees, in different countries internationally. So it's really cool to highlight, these stories to, so the community, sees them, differently, because they can contribute, and they always contribute.
I love that. I mean, thank you, Flex. Thank you for sharing that. And obviously, Maddie and Jim's. I think it goes without saying again that, just knowing and focusing really on the resiliency of individuals, their families, and finding ways to really implement and honoring their backgrounds, no matter what part of the journey that they are on or have, been on, recognizing that, but also really focusing on who they are as persons. Like Flex and Jim said, making sure we don't furthermore underutilized incredible skill sets are inevitably part of these communities, and sharing that I think is so important, like the aspects that you all mentioned in terms of the testimonial therapy, that was you, Flex, and bringing the concepts of even the post-traumatic growth, as opposed to just the distress, obviously recognizing that, but knowing how individuals can and have more to bring forward, and doing our part to be part of that, and understanding the privilege of voice, I think is so important. So next and last but not least, I'd love to open it up to questions. I know we already have a few, but feel free now to drop them in there. We'll start with Sean. Hi, Sean. I hope you're doing great. Sean is asking the panelists, are you seeing issues and stigmas intensifying for Asian Muslim refugee communities during this time? And then another question about if we know an FR translator in Chicago. I know Sean's very active in the Chicago community, looking to support a Muslim refugee family. So I don't know if anyone can help or maybe know of something in terms of supporting the Asian Muslim refugee community at this time.
James, do you want to go ahead and take that one?
Sure. I guess what I would say is that, as far as the question goes in seeing issues and stigmas intensifying for Asian Muslim refugees. I think that's something we're certainly seeing, and there's a lot of great organizations throughout the city here in Chicago that are doing work with that community to help support them. One of them is the Rohingya Refugee, or the Rohingya Cultural Center here in Chicago, which provides support to Rohingya refugees who have fled violence and persecution in Burma. Yeah, so I think there's a lot of great organizations that are doing that work and trying to make sure that those who are experiencing the stigma and the issues that Sean referenced are receiving the support they need and being supported in that way. Unfortunately, I don't know any Afar translators or interpreters in Chicago. I've also been asked that question a couple times and have been trying to work our networks to see if we can find anybody who speaks Afar. So I'll be happy to continue looking on that, but as of right now, I don't have any resources for Afar. I apologize.
No, thank you, James. I don't know, Maddie, if you had any thoughts on the issue, or just, you know, explaining kind of the diversity, I would say, of the communities that you're supporting overseas. I think that's good to know that it's also not just, you know, a blanket assumption of, you know, where individuals may come from, just this one country. I don't know if you have anything to say kind of in terms of where the communities that you're supporting from their host communities.
Yeah, well, I mean, what I can speak to is kind of the intensifying of generalized stigmas and biases against refugees to begin with. Historically, health concerns such as communicable diseases have been used as reasons for really anti-refugee policies and narratives. So certainly with a droplet transmitted and somewhat deceptive to testing infectious disease like COVID-19, there has been many examples of people using this as a reason to sort of tighten the rhetoric on refugee acceptance and migrant acceptance. As far as the camps that we work in, Lena did point out there's a huge amount of diversity. We have refugees from all walks of life. We operate at our distributions, we operate in 5 languages, but I would say that if we decided to, I made a sign with instructions for our distribution. On that sign, I think I had 7 to 10 languages that we were using that people were functional in. And so, yeah, there's a huge diversity. There's people coming from lots of different places. There's absolutely a concern amongst the refugee community themselves about people like international volunteers or new arrivals potentially carrying COVID-19. Fortunately, the areas that I work in the most, Greece and Lebanon. In Lebanon, they already had some complications with transit because of the revolutionary activities and problems with access to petrol and banks. So our communities were already quite isolated from that, which it looks like turns out that could be a benefit for their health and safety. And then Greece has had one of the best coronavirus responses in the entire European Union. I would actually argue in the entire world, if you consider the very complex dynamic that they are facing with their population movement and fluctuation. They've done a fabulous job. And so it is much more of a generalized concern amongst the populations of who could be coming into contact with them and potentially carrying the virus. And then also, like I said, what downstream stigmas will stem from this that are just used as a reason to sort of intensify the anti-refugee narrative.
Hey, Lena, just real quick, I know part of that question was a question in regards to a translator for Afar people, or the Afar people hail from East Africa, so Djibouti, Ethiopia, Eritrea. So even though it's not somebody that specifically speaks their language, I know Afar people, depending on where they're from, they'll speak the language of that particular country. So if it's Djibouti, then it would be Somali or French. If it's Eritrea, you know, or Ethiopia, you know, the different languages. So I would depending on where that person is from specifically, then you can maybe reach out to someone that's Ethiopian or someone who's you know, Somalian.
Oh. We have a huge Ethiopian or East African in general population in Seattle as well. So if they know exactly what subset specialty they're looking for. We can see if we can reach out to someone here too.
That's wonderful. Thank you, Maddie. Thank you, Flex. Well, then that kind of brings me to kind of to wrap things up, but also kind of like some final remarks, a final question. I know people are also asking, you know, how can we find insight? How can we find Refugee One? How can we get in contact with Mala? And so everyone, as you can see on the screen, you know, here's some kind of basic contact information of either following these wonderful agencies and initiatives, or, you know, getting involved or asking questions. You know, I know you all are doing, again, such great things. So for anyone who wants to know more, I would strongly encourage you to follow. And, you know, with that being said, I want to leave it up to our wonderful panelists to leave, you know, any kind of final remarks. I'm sure people want to know, what can they do? How can they get involved? And so it'd be really great to offer that kind of insight as to how people moving forward can continue kind of coming together and supporting our community. So I'm just going to go down my screen. Why don't we start with Jim's, Maddie, and then Flex.
Sure. Well, thanks again, everybody, for organizing this and having us here. Like Lena said, our contact information is up on the slide. I didn't include my email address, so I'll send that in the chat. But it's J Porter, my first initial, my last name, at refugee1.org. And as far as, you know, people getting involved, there's a couple different ways that I would recommend. You know, regardless of whether you're where you are in the world or in the United States, I think that one important thing to do is to find ways to donate and to support the organizations like those on this call who are on the front lines, helping refugees and providing the support they need. You know, there have been a lot of, I can speak domestically, there have been a lot of cuts from the federal government for resettlement. In fact, our agency alone has lost about $1.5 million in the last couple of years alone, which is pretty significant for an agency of our size. And so donations are really critical to helping and support this important work. And then the other two ways that I would just briefly mention to get involved are to volunteer. There are certainly volunteer opportunities, even right now, that if you can't volunteer in person. We're looking for tutors who can provide virtual tutoring sessions to adults or kids. So there's certainly opportunities to volunteer. And then finally, I think advocacy is a super important way to get involved. And so if you're interested in advocacy, feel free to reach out to me. I'll make a quick plug that I think there's some work being done right now in Congress to pass another relief bill. And I think it's really important to urge them to include all refugees in that bill. So you can dial this phone number to reach your legislators. You don't even have to know who they are. You just need your zip code. But the phone number is 202-224-3121. I'll repeat that one more time. It's 202-224-3121. And that's the congressional switchboard in Washington, D.C. You can reach out to your reps and urge them to include refugees in the next relief bill. Thanks.
So cool. Yeah, everything that Jim said, again, it's just super cool to be on a panel of people who kind of think the same way with these advocacy driven efforts. It's really incredible. At Insight, I think one of the best ways that you could get involved currently that we're offering, we've just rolled out a summer mentorship program. We recognize that a lot of people who are interested in breaking into, you know, the humanitarian sector, global development, international development, policy, global health, people are losing internship opportunities and fellowships this summer because of COVID-19. And that can be not just a really powerful learning experience, but also really important networking for people who are looking to launch a career or to get more involved. And so our summer mentorship program, it's going to be basically just guided by questions. We want to ignite curiosity about these different facets of advocacy, of aid delivery, of development, planning and implementation, and storytelling, and how we can kind of weave all of those things together into one unified effort to really improve the way that we're delivering, particularly humanitarian aid, but even how we're having these kinds of conversations and how we're working alongside people instead of on their behalf. And so You can go to, right now on our Facebook, you can email me, you can visit our website and contact us if you're interested in signing up for that or volunteering with us in any capacity. We're always happy to have people, and of course, funding and money never hurts. We're trying to focus on buying food right. Food security is kind of our top priority right now. We really like to follow Maslow's hierarchy of needs. And at the moment, the people that we work alongside in Greece and Lebanon, all over the world, we really need to make sure that we have food security going forward.
Flex, really quick before you jump in, I will add, because Maddie has been quite humble. They've also, I know, insight, of course, personally, in the response also for Ramadan support and actually asking individuals on the ground, what do they need? What do they like? They've also worked on prayer mats and Qur'ans, which is also really important in the concept of practicing and feeling that connection spiritually. And Maddie mentioned because I kind of mental health components. So it's wonderful to see from all of our panelists that really gearing to what families the biggest needs are, and also things that are good for them on an emotional, spiritual, and of course, you know, mental and physical levels as well. So sorry, just wanted to add that.
Quite humble. Lena helped fundraise almost 50% of the funds that we needed to pay for the Qurans and prayer mats. So if anyone wants to contribute to that, I mean, this would absolutely be a wonderful audience that we can't emphasize enough how much those mean to people. But fortunately, the vendor that we used in Athens actually fronted us, and he's letting us pay it off over time instead of having to pay all up front so that people could have these as soon as possible. We got them delivered within the first week of Ramadan, and already people are sending us pictures of the new mosque areas with the mats. They're sending us pictures of them carrying the Qurans around and reading them and saying how wonderful it is for them to have those resources. So yeah, absolutely. Thank you, Lena. We can't emphasize enough how important. It seems like such a simple thing, and sometimes with some donors, they even say like, how is that essential, when you argue that that's an essential thing? And I'm like, you know, people's mental health and that feeling of safety and security is really a top priority for us. We can throw as many resources as we want at a problem, and unless people really feel like it's helping, it doesn't do much good.
Sorry, Flex, definitely feel free to jump in. Didn't mean to cut you off.
Yeah, no problem at all. You know, again, I'm gonna echo, you know, everything James and Maddie have shared. And May is mental health, you know, month, and you know, a prayer rug, and you know, Quran, you know, is spiritual, you know. So that is really, that's really important, you know, for people. It's essential, you know. It's part of, you know, your identity, your well-being. And we mentioned earlier when you know, COVID came and, you know, sort of stripped so many things, you know, from us, you know. And for people not being able to go to the mosque, you know, is super, you know, important to them. So with that being said, in terms of, you know, Mala's, you know, work, we have our COVID-19 response, you know, on our page, on our website, malanational.org. We have a global giving page as well. You can just type in a Muslim American Leadership Alliance on global giving, and you'll find our global giving page. And through that, we've been raising money to help people, you know, that lost their jobs, and, you know, just in different, you know, areas. And last thing I would say is, you know, it's important, you know, to donate money, but at the same time, it's also important to volunteer. So, you know, anything that you do is important. Even just, you know, being a friend, you know, for someone, you know, that is in need. You know, they don't necessarily have to be, you know, a refugee, but someone who's in need. You know, so that's really important. You know, so we've been focused on reaching out to people to see if they, again, need help with, you know, tutoring, and just reaching out to some of the people in our community to see who would be interested, you know, in those type of, you know, projects. But, you know, soft skills are really, you know, important as well when, you know, you're unemployed and looking, you know, for new jobs. So we've built a lot of, you know, webinars, you know, around that, around different forms of, you know, literacy, whether it be financial literacy, and so on. So I would like to, thank you, Lena, for putting this all, together, and for being an amazing, fellow from Mala. I also want to thank our Mala team, Khalil, for putting together all the artwork and the designs, and also Andrew, who's our operations manager, and putting together the production, for this webinar. And I also want to thank everyone that's joined, today to be part of this discussion. And all our handles and emails are on the screen. So please reach out and let us know how you would like to be involved. The need is high, and we're in this together. This is not a COVID is not a local crisis. It's an international crisis, and it's affecting all of humanity.
Yeah, couldn't have said it better myself. Thank you, Flex. And of course, the incredible Mala team, and of course, Jims and Maddie, who couldn't have asked for a better group of panelists to really help us, of course, understand what the narrative is, but how we're going to shift it, and we're going to shift it together. So thank you both so much for joining us and being part of this. Thank you.
Thank you all for organizing, and for everyone who tuned in to listen. It's super appreciated. Awareness is everything.
Thanks, everyone. Really appreciate it.
Yeah. And please check out Refugee One, Insight, Mala. No matter where you are, you can have a part, and you can have your voice heard as well. So definitely reach out to these incredible organizations, and of course, donating your time and money goes a long way in support. So thank you, everyone.